Good afternoon and welcome once again to our weekly COVID-19 public health update with Montgomery County Executive Mark Elridge. I'm Lorna Vigilla, Hispanic Public Information Officer. Thank you for joining us. And today also joining us is Dr. Earl Stoddard, who is Assistant Chief Administrative Officer, as well as Sean O'Donnell, Program Administrator, Public Health Preparedness and Response for the Department of Health and Human Services. And today we have a special guest, Dr. Amina Johnson, who is the county's LGBTQ plus liaison. Reporters, we're going to have a presentation from the county executive, then we're going to open it up for Q&A with Dr. Johnson and the county executive, and then we'll move towards the public health update. And with that, good afternoon to you, Mr. County Executive.
Thank you, and thank you everybody for joining us again today for our weekly media briefing. First, I'd like to just take a quick moment to address a couple of MCPD issues. This morning, we've been made aware that there was an arrest by MCPD of an individual that has threatened the life of Justice Kavanaugh. The FBI is taking over the investigation. We'll be updating the media moving forward on these developments. Political violence is never the answer, and while I understand the immense divisions in this nation, we cannot allow and accept this kind of behavior, or even the threat of it, to solve those divisions. Violence in any form is not going to be tolerated in this county. And to be blunt, violence is only going to exacerbate the tensions, not improve them. Additionally, I expect questions today about Assistant Chief Carmen Faciolo being put on administrative leave. I had my briefing with Police Chief Marcus Jones about this matter earlier today. Because this is a personnel matter, I'm prohibited by law from providing any further comments on this, but the matter is currently being looked into. And I will not be taking questions on this since I won't be able to answer any of them. Turning to other issues, we're in the middle of Pride Month, and yesterday I was joined here in Rockville by Montgomery County Council Vice President Evan Glass, other council members, and members of the Montgomery delegation to the General Assembly. They, along with leaders in the LGBTQ community, helped us honor Montgomery County's history as a progressive trailblazer for equal rights and continue the Pride Month celebration. I thought Councilmember Katz has said it best, that in Montgomery County, we don't just celebrate Pride Month, but we live a Pride life every day. But for us to serve this community best, we must first listen to their needs and concerns. As I mentioned yesterday, I'm happy to announce a new survey that will help us address issues within the LGBTQ plus community. Our Montgomery County LGBTQ plus Liaison and Advisory Board, launched by the Office of Community Partnerships, is using an online survey to gather information on a range of issues tied to health and wellness. We believe the survey is the first of its kind, a questionnaire meant to identify and ultimately address social issues and unforeseen barriers faced by the LGBTQ community. The survey is going to be available in several different languages, including English and Spanish. The idea is to be as broad as possible and use the information gathered to help inform the work of advocates and potentially other county resources and services. Participation in the survey is anonymous, but it's crucial in helping us fulfill our goal of making sure that everyone feels safe and welcome in Montgomery County. Joining me now to discuss the survey is Dr. Amina Johnson. Dr. Johnson came to Montgomery County a little over a year and a half ago to be our first LGBTQ plus liaison. Her work, including planning cultural programs and events that highlight the diversity here and creating the 7-member LGBTQ plus advisory group. Dr. Johnson is currently the Associate Director of LGBTQ Resources at Georgetown University and the co-founder of the Black Woman Aesthetic. I'll now turn it over to Dr. Johnson to tell us a little bit more about the Pride Month survey and how we're planning to use it. So Dr. Johnson, take it over.
Thank you so much. Thank you everyone for allowing me to be here. I actually have a PowerPoint with information. If I can be allowed to share my screen, I can share some information about the survey and show you a couple of screenshots of the survey. But while we're waiting on that, as the county executive said, the survey will be totally anonymous. And it will be open it's open now, and it'll be open until July 15th. You can find it on the homepage of the Office of Community Partnerships. I will put that in the chat for you. And it can be posted in the chat. And it is in 4 languages. The languages are French, Spanish, Chinese, and English. I know that those are not necessarily the top 5 languages in the county, but the platform that we are using only allows us to do those languages. It won't allow us to do any other languages. And some topics that are going to be covered in the survey are, we're going to ask questions about healthcare and housing. We're going to ask about parenting, so we can learn how many families are LGBTQ, parenting in the county, as well as asking about education and interactions with law enforcement, among other things, such as the ways in which people identify their LGBTQ identity. And I'm the contact for that. I will also put my contact information in the chat. I will put my email and my cell phone number in the chat. And that's really, the basics of the survey. So if folks have questions, I'm open to them.
Thank you, Dr. Johnson. Reporters, members of the media, do you have any questions regarding the survey right now for Dr. Johnson and or the county executive?
Sorry, Steve Winell, Bethesda Beat.
Thank you, Steve. Good afternoon.
Afternoon. Yeah, just can you go through this survey, kind of how you formulated the questions, just that process?
Sure. The survey was the idea of the LGBTQ advisory group. And as the county executive said, there are currently 7 members on the advisory group. And the task of myself and the advisory group is to share information and education and resources to the LGBTQ community. So myself and the advisory group felt that the best way to do that would be to gather some information about the folks who are LGBTQ plus in Montgomery County. And so we sat down and we came up with some questions and some general topics. And I must also say that we are having help from Emily Brown in ending the HIV epidemic and Health and Human Services. They are providing the platform for this survey that will be filled out online. And they helped us hone in on the questions and the topics as well.
And I imagine the survey will obviously inform this, but in terms of any kind of legislative initiatives or funding in the future that this might show that you all need to do, and anyone can field this question, how might the survey kind of help that, and where might you already see need, as simple as that sounds?
I'm not sure where we're going to see a need. That definitely the survey is going to guide that. I can let someone else, I'll be writing a report based on the survey results. And, if there needs to be legislation, I will let that report and the survey responses guide that.
Is there anything, I guess, locally within our jurisdiction that you're able to do? The reason I bring this up is that there was a bill in Annapolis, I don't have the number offhand, but that focused on providing more services, health services to the LGBT community. It didn't pass, but there was a lot of discussion about that earlier this year. And again, anyone can kind of field that, but that's kind of what I was getting at with that.
I'll let somebody else field that question. I don't know that I can answer that. And then I see Kate Ryan has a question too after that.
Yeah. Thank you, Steve. Kate Ryan, do you have a quick question for Dr. Johnson? Good afternoon.
I do. Thank you very much and good afternoon. And Dr. Johnson, yes, and I think Steve already hit a couple of things, but I did want to ask, is there anything that you're hearing from the community that a question you need answered. In other words, are there issues you expect to hear from members of the community, and anything in particular you're hoping to learn? Are there unanswered questions in your mind, like, hey, we need to hear more from this community on X, Y, or Z?
I think the main thing in my time here that I have heard from the community in Montgomery County, and this goes for communities in other surrounding counties like Prince George's County, being in such close proximity to Washington, D.C., a lot of times folks are, just expected to go to DC. And so while there are some, services for LGBTQ people in Montgomery County, I am certainly here. I want to know what other services that folks aren't getting in the county that they would like to get.
Got it. And a quick follow-up, are you expecting to hear from younger members of the community? And I ask that because years ago, I did an interview at Whitman Walker with someone who specializes in caring for and counseling youth, and the discrimination that they talk about, the concerns about just their physical safety, but also just their mental health in the stress that they face in coming out to family or whatever the case may be. Are those issues that you will also be looking to hear? Is there an age limit to who can respond or any kind of parameters?
No, there's not an age limit, and they can check their age in there. And I've worked with MCPS. I am on their Pride Alliance board. I have sent this survey link out to the Pride Alliance of MCPS, and we really do hope that we get a lot of responses from young folks because, as you said, their needs do differ from those of LGBTQ adults.
Thank you very much. I appreciate it.
Mm-hmm.
Thank you, Kate. Any other questions from members of the media regarding the survey? Okay, so we can move forward with the COVID-19 public health update, Mr. County Executive.
Okay, thank you very much. So we're going to resume to the COVID part of the update. By the end of June, we're maybe entering a new stage in the fight against COVID. The rollout of vaccines for kids under the age of 5 could begin as early as June 21st. That's contingent on the FDA granting emergency use authorization for the vaccines, which is expected to actually happen soon. And when it does happen, roughly about 19 million young children in the country will have access to federally approved vaccines. Montgomery County has been planning for this and for the rollout, and we've placed our initial order to get those shots into arms as quickly as we can. Montgomery County should have about 4,000 doses of both the Moderna and Pfizer vaccines. We anticipate distributing those shots through health clinics at the end of the month. COVID vaccines for kids at least 6 months old and up will also be available through pharmacies and private providers countywide. It's going to give our entire nation a level of protection against the virus that we know continues to mutate and spread throughout the population in waves. But because of vaccines and booster shots has resulted in fewer hospitalizations and deaths. You can see by the charts above that this week's COVID numbers show a decline in new case rates. We were once again close to 300 cases per 100,000 residents, a more than 20% drop from last week. The hospitalization rate has also decreased slightly. Montgomery County CDC community level status still remains at medium. And as you can see from this other chart, the BA2 strain continues to make up about 90% of new cases reported in our region, but we're beginning to see the BA4 and 5 strains that now account for about 10% of new cases. That's a significant jump over the last 2 weeks. The threat of new variants only emphasizes the need for people who continue to take safety measures like cleaning your hands with sanitizer, wearing a mask in crowded indoor spaces and on public transportation, and taking this seriously. And your vaccination status matters. Our unvaccinated COVID rate is 4 times as high as those for people who are vaccinated. And if you are vaccinated, you need to be boosted. The efficacy of these vaccines wanes. And just because you're vaccinated and even caught COVID before does not mean you're not going to catch it again. I've already talked to people who are into their second case of COVID. So even getting COVID doesn't offer permanent protection against getting it again because the variant continues to morph and be different than it was before. So I'm going to continue to encourage people to please get boosted. The outcomes are so much different between boosted people and unboosted people that they should not be ignored if one's concerned about long-term health and safety. It's absolutely critical that people get the booster shots and get your first shot so you haven't already done it. Through all of this, long COVID remains a real thing. And we continue to read reports about studies being done on long COVID. It can have both long-term and short-term health impacts that can be serious. And we're going to be highlighting this in future briefings. I think the focus on case rates and hospitalization and deaths has kind of overwhelmed the information about long COVID and what could happen and why it's important if you're experiencing symptoms to go to a doctor to see what kind of treatment or interventions are possible. But this is not an insignificant thing. And like I said, we will bring you additional information on this. On other news, FEMA assistance has been crucial. But these funds are due to expire at the end of this month. We're calling on the federal government to extend this assistance past June 30th. FEMA has been giving to states and counties for many months and now allows us to easily set up clinics, test for COVID, and keep Montgomery County safe. We implore the federal government for an extension, especially with the new round of vaccine clinics anticipated for younger children, younger than 5, as well as a potential threat that another surge is looming with BA4 and BA5 variants, as well as potential variants that are likely to evolve. It's premature to cut the funds off at this time, and we're still not out of the woods yet. I have to say, the federal government played a very large role, not just in Montgomery County's response, but in the response across the nation to help jurisdictions deal with this. And it was important not just because the response helped jurisdictions to deal with COVID effectively, but also because it helped jurisdictions maintain budgets that didn't force decisions between additional COVID funding, which, as we know, can be quite expensive, and maintaining basic services in counties all around the country like ours. And the federal role was really critical to maintaining that broader health. The healthier the community and the more normal people are to provide services to people, the more likely that jurisdictions are going to be more financially healthy in the long run. So we don't need other things that will contribute to challenges for Montgomery County or any other place in the country to meet basic needs of residents if we're not getting support on the COVID front that we need. So I'm hopeful that the government will actually consider extending this. I want to move on to talk about our Police Accountability Board recommendations. I think, as people know, there's state legislation requires us to appoint the Police Accountability Board. And our office is releasing today the names of 9 people who we will hope will comprise the first Police Accountability Board review panel that has been administered by Dr. Stoddard. Reviewed more than 60 applications that we received for these board positions, and the following are the 9 who were recommended by me, and they'll be sent over to the County Council for confirmation. We've asked Bishop Paul Walker to be the chair of the board. Other members are Alicia Hudson, Kenneth Kellner, Dr. George Uberes, Rudy Logan, Catherine Manning, Alvin Greg McCrae, Thomas Williams Jr., and Christopher Zatratz. We selected fair-minded residents that we believe in, who we believe understand procedural justice, and we believe these individuals will bring increased accountability and transparency that will improve our police department and public safety in Montgomery County. They represent diversity of backgrounds, cultures, and community engagement experience, and we're hopeful that they can address the kind of issues that will be brought before them when the actions of police officers need to be reviewed and analyzed. In accordance to state law, the Police Accountability Board needs to be established by July 1st, and the County Council will confirm nominations by June 28th. I want to thank the 9 individuals for their willingness to serve on this board. I also want to send my appreciation to Dr. Stoddard and the review panel for their equitable selection process. And I'm grateful for the legislative efforts, partnership, and cooperation of our state delegation and our county council members for their work to implement this board. And with that said, I'll turn it over to Dr. Stoddard, Dr. Bridgers, and Sean for further updates.
Thank you very much, Mr. County Executive. So are you all able to see the title screen here?
Yes.
Okay. Just to again, I know that Mr. Eldridge shared a couple of these, and so I'll go through some of these very quickly. Again, this is the HHS variant typing. It does take a couple of weeks for them to get this detailed data on the types of variants they're seeing through subsampling of individuals. And the most recent 2 weeks are projections that they do, and they are projecting that our increase of BA4 and BA5 as a percentage of cases, even as our cases come down, but that will increase as a percentage of cases. If you go to the HHS website, you'll see many parts of the country have even higher percentages right now within BA4 and BA5. We're continuing to monitor it because there is the possibility that, again, a different variant can evade previous immunity that was gained through vaccination or through previous exposures. So we'll keep tracking this. We do not see right now a large number of cases in our region, but we do expect that this will increase over time, and we'll see if that leads to an increased number of cases as well. When we look at our global impacts from COVID globally on a large scale, many of the regions continue to have declining COVID activity, as you can see here, looking at each of the different areas. There have been some areas that have had that BA4, BA5 in South Africa, notably. Some of the European countries are seeing some of that activity, but again, it hasn't resulted in similar spikes yet, like we saw with the earlier Omicron, but that's not to say that it won't, it just has not yet. Again, we've looked at the state-to-state data as well, particularly for some of the New York and New England states, which had the BA2, BA2.12. And as we've said before, we started to see them level off, and now we're seeing them declining, much as we're seeing ourselves decline here in Montgomery County. And the state has, across Maryland, has leveled off a little bit as well. But again, this is kind of consistent with how this variant has played out during this wave. Just our dashboard has just updated over the last few minutes, and you can see our case rates continue to come down. This is, of course, just PCR testing, but the PCR testing, we're confident, is reflective of the rapid testing, even both rapid testing reported, unreported. That certainly would affect the amplitude of this case number, but the same positivity levels we believe are happening. As you can see, the hospitalization, new admissions are declining now too, although our hospitalization bed rates are holding a little bit steady, and they may for a little while, as it takes a little bit of time for people to clear of a more serious illness. The reason, again, that our county executive has emphasized the difference in case rates by vaccination status and hospitalization rates by vaccination status is because we have a new group of people who are about to be eligible for vaccination. And just like the previous groups, they are also subject to increased case rates. And when we say that, when we talk about how BA2, BA2.12, maybe BA4 and BA5 can have breakthrough cases, can still infect people who are vaccinated. You see that those rates are lower, though, for people who are vaccinated. So it can happen. It's certainly happening at a much higher rate for the unvaccinated, and we do want to share that information with the community. And it's not just in our community, this is nationwide. As the New York Times has reported, the case rates are at least double in unvaccinated populations. The death rates are as high as 8 times as high in unvaccinated populations. And so we can't stress enough how important vaccine is. Even if it doesn't prevent the initial infection, it is preventing more serious illness. Looking at our hospitalization rates more clearly, again, we see that about half of our patients, a little more than half of our patients, are currently at the Washington Venice alternate care site. A lot of patients transferred from other hospitals there. Some of them are still receiving treatment at that site, obviously, but have been stabilized. And again, that's been a very valuable part of our community's ability to continuing offering other hospital services, even while COVID rates are up. And you can see during this last wave, lots of cases, but much, much fewer hospitalizations compared to the December and January Omicron spikes. Just going through with the vaccinations, I know our county executive covered the most important points about the timeline. We have placed an order for both vaccines, we're assuming both of these will get approved. And so with the wave 1 allocations, it's a little different than the ongoing vaccine. When we get into this new one, the state will be determining allocations, at least for the first few weeks, to make sure that they can get vaccine out to all the individuals asking for it. The county will get some amount of vaccine, but again, we want to remind parents that a lot of the vaccine is going to the private healthcare, the spectrum of providers, the pharmacies, the pediatricians. We strongly encourage parents to reach out to their pediatrician, ask if they're placing an order. We are strongly encouraging all of our pediatricians to place their own orders, because that will increase the vaccine available to us. We know there's a lot of interest in Montgomery County to get their kids vaccinated. It reduces case rates. It helps keep people in schools and in childcare settings if they're exposed. So we really are excited about bringing vaccine to this group of people. And as you can see, we're starting to record in our data, even the 5 to 11-year-olds coming out for a booster shot, because they are eligible now. And we're seeing those rates start to come up. We've updated our charts in the pulse report to track that. Finally, just within the testing world, again, we're still seeing a much higher positivity rate at the county clinics. We're seeing about 23% positivity. Just again, emphasizing this variant is still going strong in our community, even as the numbers come down. Our overall testing has declined volume-wise a little bit, but there's still a lot of people testing positive. So we encourage people to engage in safe behaviors, wear masks when they're in community settings to protect themselves and to protect other people. And again, we're hoping that we'll be past this surge very soon. At this point, would like to turn it over to Dr. Stoddard if he has any additional comments related to the presentation.
Yeah, the only thing I would add is we are doing an additional round of distributions of rapid test kits to our childcare providers this week. Actually, I believe tomorrow is the distribution, then again on Saturday. We've gotten numerous requests for test to stay in the childcare setting, which obviously the facilities have to be able to support, but obviously we are happy to provide test kits to help support that. So that distribution will be taking place at a couple different locations across the county over the next few days. And so just wanted to bring that up. We are also providing additional rapid test kits to our municipal partners, and we continue to offer them through the normal settings that people have gotten in libraries and rec centers for rapid and PCR testing. So just wanted to make sure to reiterate those things. So I know I'm going to guess there are more than a few questions today, so I think I will stop.
Thank you, gentlemen. And yes, first set of questions, Kate Ryan, WTOP. Good afternoon again, Kate.
Unmute. There we go. Sorry. I did want to ask about several things. I know, County Executive, you said you can't talk about personnel issues, but I'm not sure people understand the role of the civilian assistant police chief in light of him being suspended for, again, you're not disclosing why. Does that impede the job of police in the county? Tell us about that role and what it means second question would be on the after action report on the Magruder shooting. What is your reaction? What concerns do you have? What shortcomings do you think need to be overcome as a result of what you saw in that report?
Please unmute.
I was trying to save you the drilling noise in the background. So the role of the civilian police chief, assistant police chief, was to help in community building relationships between police and the community, being kind of a liaison, both bringing messages back from the community, helping communicate from the police department into the community, and working to resolve issues and problems. I mean, I've had a number of constructive discussions with Carmen over the year, where he saw things that, weren't like violations of policy, but where little things that matter would make a difference. And so that was sort of his historic role. Out of Magruder, and it's really tough. I mean, the hardest thing is, monitoring who comes into a school and what they come in with. And, I continue to think that, there should have been a lot more emphasis on the necessity to report what people see. And I don't know, we cannot emphasize this enough with our students. I think we have to, double down and letting them know that it's absolutely crucial. You can't be bystanders and you can't be disinterested from this. I think we've got to, this is why we wanted to put, psychiatrists and social workers into the school, so that you could actually have more opportunities to talk with students and to engage with them, and to have, and it's not all about strictly psychologists and social workers, but, peer intervention specialists. There's a range of people who can do this kind of job. We have to understand more about, beefs that go on in school. I mean, what strikes me here and in other places is, a lot of incidents occur out of longstanding beefs. And you got to wonder how much we're doing once we know that there's a beef between two people to actually mediate it, rather than just wait till it boils over into something more serious. So we're going to take a look at it. We're going to talk with all the people involved, the school system, first of all, and the police as well, about, what can we do with the roles? How do we envision what we're going to do with enhancing mental health supports in the school, and how will this report inform that?
Got it. One of the questions that came up was on access to exterior doors. And I know that this police department, since Columbine, dating back to 1999, did trainings where they literally mapped the schools so that their SWAT teams knew where to go, what to do. Are you surprised that this many years later, there are questions about police access during an emergency?
Am I surprised? Probably not. And I think there, a number of things that over time, there's a level of vigilance, particularly when you don't have incidents, does, kind of wanes. And I think it's an opportunity for everybody to, make sure that the doors are locked. My sense was that they're pretty certain the doors are largely locked, but it's not, as it is right now, it's not impossible to unlock a door. And I, from a safety point of view, where there are a fire or emergency where people had to escape, the doors can't be unlockable from the inside. Otherwise, you could potentially have classroom or classrooms queued up to try to get out of a door, waiting for someone to get there with access to unlock the door. So, which of course then becomes a vulnerability in the system. If somebody wants to leave a door open, there may be ways to do that. Hopefully that will drive people to look at what they could do to further enhance the assurance that doors are closed when they're supposed to be closed.
I would also say, Kate, one of the collateral impacts of the COVID-19 pandemic was that some of these in-person trainings and exercises weren't being done nearly as much. And so I think that, I think that this has been a reminder that we need to get back to doing some of those activities that we did a lot more often where, certainly the security of the schools do check the doors regularly. So it should not just, it doesn't fall just back on the police department. But again, we would do, I'm not talking about student-based active shooter drills, but with police officers actually training to do these, working with security on how to respond to them, typically in vacant schools, not while students are there. But I think that those are the kinds of things that we probably need to continue to do. We did them a lot before COVID. During COVID, it creates this break. And so all of these things like checking doors, they're only as good as the emphasis that you maintain on them. You can't do them for periods of time and then not do them for periods of time and expect it just to maintain. And so I think it's one of those things where it's a reminder that we need to keep doing many of those things that we really did a lot pre-COVID, and get really back to them now that we're much more in person and really reestablishing those non-COVID related priorities.
Got it. And I realize this may be a question more for school authorities, but Dr. Stoddard, I'll ask you while I have you. I think you're familiar with these, the bleed kits that schools do have. Do they include, and I don't mean to get graphic, but I know there are several types. Do they include the chest seals?
Yes.
Okay, so that is the model that the schools.
So I mean, I'll go in. I mean, I can actually talk about this issue because we actually worked very closely with the schools to get them those kits. Those were an urban area security initiative purchase. It's a Homeland Security related grant. We worked very closely with the school administration to get those put into all of our buildings. We're actually in the process of installing them in many county buildings. If you come visit the second floor in the executive office building, you'll see one in the lobby stairwell. They're all the same kits that the schools have. They do have chest seals. They do have tourniquets. They do have, bleeding control materials and all the things you would need to do to protect against, not just shootings, but other catastrophic injuries. Like we made sure that near the wood shops there were kits so that if there was a shop-related injury or any other injury that could result in that need a medical intervention that was rapid, that they had those. And so, I think there's, throughout the system that they're now distributed, the cases were installed, and we're doing the same things in libraries, rec centers, and other public-facing county facilities right now. It's all part of the same effort. We started with schools because we recognize the importance of protecting our students, but we're expanding that to include other places where those resources might be necessary.
Gotcha. And again, just to get you to describe it, the chest seal is for large open wounds?
Yes. Yeah, it's basically when you have particularly sucking injuries where you have puncturing of lungs or things like that. They will help seal primary torso injuries, penetration wounds of that kind.
Got it. Listen, I thank you all very much, and other reporters have questions.
Thank you, Kate. Up next, Steve Bonell, Bethesda Beat. Good afternoon again, Steve.
Good afternoon again. Returning to the Police Accountability Board, simple question to start off. How big was the applicant pool for the PAB, roughly, if any on this call?
There were about 65 applicants. We had some duplicates, so I'm pretty sure it's about 65. 58 of those were complete applications, meaning they'd submitted everything that was requested. And then of those 58, we interviewed, I believe, 21 or 22 individuals based on a preliminary review of their resume and cover letter. And then from that, we narrowed it down to the 9 for the Police Accountability Board. And obviously, the executive has 2 nominees for the Administrative Charging Committee, which is sort of a subsection of the PAB. And we essentially used a similar or the same pool to narrow down that list as well. We'll be making that announcement in the near future.
Can you go a little bit, I don't know how much you're going to say, but the interview process and what that looked like? I guess particularly you were on the review panel, Earl, just what that looked like.
Yeah, so we did remote interviews. They lasted about 30 minutes. We had a set of questions that we kept uniform for all the candidates. The panel was myself, Tiffany Ward, the director of the Office of Racial Equity and Social Justice, Greg Wims, who's the Upton County Regional Service Center director, and Dale Tibbetts, who's a special assistant to the county executive. Did not include anyone from the police department for obvious reasons, but we kept it to people who were either active in the the social justice space or who have been greatly involved in various parts of the county or community, so they could speak to that. The interviews there were I think 9 questions that we asked in total. They've ranged, they basically asked about the person's experience, their interests in being on the board, what they thought they brought to the board that was unique from other individuals, and tried to get an understanding of whether they were going to be balanced in their view of how to view. We said this very overtly to candidates. We did not want people who were going to rubber stamp anything the police did. We also did not want individuals who were going to think the police were guilty of doing something regardless of the circumstances. So we wanted to make sure that we had people who could look at facts, review materials, review policies, and make sound judgments about administrative charging decisions or on those policies and whether they contribute to potential misconduct and or poor community interactions.
So clarifying question about the ACC. So it's understood that likely, although not guaranteed, that the chair of the PAB would also be the chair of the ACC. So if Bishop Paul Walker is the chair, I'm guessing he's one of the people. And then do you have another name you're going to announce that might be the chair? How does that work?
So the way that it works is that the PAB chair either themselves serves on the administrative charging committee, or they have to designate a nominee or a representative of themselves to sit on the administrative charging committee. That's one of the 5 members. 2 of the 5 members are selected by the PAB itself. So these 9 members will select 2 additional candidates, and the county executive gets to select 2 others. So of the 5, the county executive gets 2, the PAB gets 2, and then the chair of the PAB, in this case, himself or his representative, sits on that as a 5-person group.
And the July 1st deadline, does that apply to the ACC, or is that different than according to state law?
It's really the PAB that it focuses on. Obviously, we would have liked to have had both, but frankly, just given the changing requirements of the legislature in this session, it really put some pressure. We still don't have the regulations from the Maryland Police Training and Standards Commission about these PABs and ACCs, but so we're sort of moving ahead without all of the information that we would have liked to have had. But obviously we wanted to have a seated PAB minimally before July 1st. Now, I think an important thing here, I will also say, and we're going to have by the end of this month a portal that people can file PAB related complaints to. So if they have complaints of misconduct to any of either the municipal departments, the sheriff's office, or the police department itself, they can file. There'll be an online portal available in multiple languages that people can file these complaints about. And then obviously remembering the process here. So those complaints go to the PAB. The PAB refers them to the appropriate police department or agency that investigates. And then those investigative files come back to the ACC. What that naturally does is effective July 1, when those complaints start to come in, there will be a period of time when investigations are ongoing that the ACC won't have anything to review yet. So naturally sitting the PAB so they could select the ACC members was the most important thing for us to get done by July 1st, because that natural built-in delay in any materials that the ACC would have to review by several months. These investigations typically take at least a couple months to complete in most cases. So, yeah.
I'm sorry for another long question, but I think it's important. You mentioned these kind of state guidelines that you've been kind of waiting on. I forget the technical term for the committee that does that. What questions remain that, because you don't have these guidelines, just what information are you still seeking, I guess, that those guidelines kind of fill the blanks in? Yeah,
so the way, so there's been a significant conversation between the Maryland Police Training and Standards Commission and the Attorney General's office about what the latitude that the MPTSC, the Maryland Police Training and Standards Commission, has to set forth, for example, eligibility criteria for PAB or ACC members. There was a lot of discussion, and these are all public meetings. So if you want to go back, I think there are links on the MPTSC website, discussions around settlement agreements. So for example, if an officer was accused of something and they want to admit to wrongdoing, but take a lesser penalty, and then have there was a discussion at that level whether those kind of things would be permitted to happen. There was a lot about process for how members can be removed if they're found to have done something inappropriate. There's some additional details there that are just relevant to the process of how these PABs and ACCs operate in function. And we obviously don't have that guidance. We haven't been told when we'll have that guidance. So if we don't have it by July 1st, we'll be kind of really flying You know, we really try to operate without all the information we need to operate, unfortunately.
The county executive can chime in on this one too, but I guess, and I'm not saying this is happening, but it's just a hypothetical that if not all these names are confirmed, do you have kind of a backup list of people to quickly plug in so you meet that deadline?
So it's obviously the discretion of the county executive on who gets nominated. We do have additional candidates that we did vet and we do think would be entirely appropriate. I mean, in Montgomery County, we have incredibly qualified and engaged residents. There were a number of people who were eminently qualified and had met every other criteria, but we can only name 9. So yeah, the short answer is it would be up to the county executive to decide who we wanted to send over at that point if someone was not included. We don't see any reason why any of these 9 would not be approved, given our vetting of them. But if they, for some reason, weren't, we do have other candidates who were incredibly qualified who certainly would be appropriate for the county executive to consider.
Thank you, everyone.
Thank you, Steve. Up next, Dan Shear, also from Bethesda Beat. Good afternoon, Dan.
I had a question for Mark, just on Assistant Chief Facciolo. I know he had a lot of different responsibilities throughout the county. I know he had some involvement with like the MOU involving the police and MCPS. I guess who's going to fill the void while he's out, or sort of what will be the way that his responsibilities will be fulfilled?
I believe that, the chief has assigned responsibilities to another officer in the department, and they'll continue doing the same work as was being done until we resolve this.
Do you have any expectation of how long that's going to be?
No, because this only happened, I mean, I get a briefing this morning, so I imagine it's going to take a little while to sort through everything, but I don't think this is not going to be a long process, I don't believe.
Can you at least say if it was for a reason related to his job or something else?
No, I really can't.
Thanks.
Thank you, Dan. Stephanie Ramirez, Fox 5 DC. Good afternoon, Stephanie.
Good afternoon. Thank you. I apologize if I wasn't putting in the question in the right location. County Executive Elridge, I also have a follow-up question on Facciolo.
Sure.
I do want to ask you, we're hearing some frustration from department members that there were other qualified people for this civilian position. I want to ask you, why did you feel a 35-year-old, essentially a policy advisor with no actual law enforcement background as an officer, was qualified for this assistant chief position that carries certain weight and power as a member of the police department?
Because it was meant to be a civilian chief, and we were not looking for another police officer to be another police chief. It comes down to that simple. There are always other qualified people. Just as the question before about what we would do if somebody isn't approved on the PAB, there are other qualified people. The group that did the interviews thought this person was the best person, and that's the person that got selected. Could there be other people? I'm sure there are other qualified people, and I'm sure, that we could have made other choices that have also been qualified. But it's not unusual. I mean, it was certainly our intent to make sure that this was a civilian position, and so there was kind of an emphasis on that part of it.
Can you also talk about that position itself? Are they required to be certified and in CPR or other life-saving training as other assistant chiefs are required to be certified in?
I cannot answer that question, and I'm sure that's one of the things that will get looked at.
Can you tell us anything about, your concerns with what you know? I understand that you were made aware of this last night and that there was a briefing with the police chief this morning.
So I can't really discuss it. I mean, I made it clear at the beginning, I cannot discuss a personnel matter.
Based on what you know, should he be fired?
I cannot discuss a personnel matter.
Any response?
They're doing it. They are looking into it. I don't even know what their final conclusions are.
I understand that, but the allegations are very serious, egregious allegations that include violation of ethics. It sounds like
That's why you do investigations. You know, you don't convict people before you find out what's going on actually.
This is also someone that is your hire. Any response to those in the community who might feel concerned about the response that it's a personnel matter, you can't comment on it?
No, I think people in the community know that certain things are personnel matters. If it becomes something other than that, there'll be other responses, but it's a personnel matter right now.
Okay,
That's the
thank you.
law. It's not like my personal choice. It's also the law.
Thank you, Stephanie. I do not see any more questions coming from reporters. Going once, going twice. Well, thank you everybody for joining us today. We'll see you again next week. Stay safe. Have a great afternoon. Bye-bye.